Good morning, everybody.
Good morning.
Welcome to our first foray into Instagram Live. We decided that little Tweedledee and Tweedledum here, no, just joking, are going to start the office out going. So I'm Dr. Rachel Pritzker here at Chicago Cosmetic Surgery and Dermatology.
And I'm Dr. Lauren Fine.
We are both board certified dermatologists and fellowship trained in cosmetic procedures. So we hope we have met most of you who are tuning in, and if not, we hope to meet you all soon.
So we're going to do a little Q&A session. We have some questions that people have shouted out over the last week pertaining to everything skincare. So we're going to kind of take turns, and here we go.
Dr. Fine, this question is from Life of Alazu. What is a simple skincare routine for guys to follow? I don't want to do more than I have to.
Great question. I get questions like this every day, and I have a lot of patients that come in with bags of skincare products using 8-10 different products a day. And I think that the best advice to follow is to really keep it simple and to use 2 or 3 really good products. You don't need to overdo it. I think people make the mistake of over exfoliating and using too many different products, and that can really affect the skin barrier and cause more irritation. I think in the wintertime, everyone needs a really good basic moisturizer, a good gentle cleanser, and obviously a good sunscreen for the morning. And then at nighttime, you want to think about adding something like a retinol, which can help with exfoliating and which can help with pigment and smoothing, or something like peptide, which can help with collagen stimulation.
In terms of any skincare routine, guys or girls, it is important to keep it as simple or as complex as you can handle, because consistency really is the key. You are not going to see a result in a couple days with any skincare product. Your skin really needs to change, and then you have to maintain that change. So sunscreen is always important to keep in any regimen, and then some sort of product at night that's going to make sure that your collagen and that your tissue remains healthy. So whether or not that's a retinol or a peptide or a growth factor. But again, it's just the consistency of using products and staying hydrated is really the key. So you can make it as simple as long as you're doing something.
Yeah, and to be consistent, and it's not going to, usually with any skincare routine, you're not going to see results overnight, but you got to give it at least 2 to 3 months and really stick with it. I do see a lot of patients that are changing things up every few weeks or every month, which isn't really giving your skin time to see the result that you're looking for.
In terms of guys, and I know we're spending a lot of time on this question, and we'll move on. And hi, everybody. This is actually really cool that I can see. Always see SPF. That's Sarah. Oh, that's literally Sarah right here. But with guys also, you have to remember, like with shaving, you guys are like physically exfoliating the skin like a lot more than women are. You're literally taking the blade and taking that top layer, and then you're using sometimes like an aftershave, which can be really astringent and alcohol based. So you're getting a lot of surface damage sometimes by just your shave process. So we need to simplify the shave process sometimes to actually result in better results, to prevent folliculitis and acne of the beard area and things like that. So come on and see us if you have issues with that, because that's something that we really can medically and cosmetically treat.
And one last thing about products, since we're here in Chicago and it's about 20 degrees, you have to think about how your skin changes in the weather, and everyone is more dry and your skin isn't retaining moisture as well, so you have to be even extra careful with products. Okay, here we go. Question number 2 for Dr. Pritzker.
But coffee first.
Dr. Pritzker, this is from Crazy Gemini 12.
I'm a Gemini.
Can I get a skin peel where the top layers of the skin actually fall off for several days before filler? If so, how much time should be between the 2 treatments?
So it's interesting, and I think that every doctor is going to be a little bit different about that recommendation. The point is that when you do filler, 2 things. You want to make sure that the skin is sanitized so that we're not having any bacteria or anything on the skin that would then get introduced into the deeper layers. So if your skin is not able to be completely cleaned for that procedure because it's too sensitive from your peel or whatnot, that wouldn't be an ideal day to do it. So I can't give you a good timeline. Also, people respond and peel from peels at like such different rates depending on how thick that top layer is in the first place.
And depending on what type of peel. There's such a variety of peels. Some are penetrating significantly deeper than others, but most of the peels that we do in this office are not deeper peels.
So majority of the time, I would probably want you pretty healed if you were doing a deeper peel before I'm introducing a filler through the skin. And the other thing is that if you're swollen from any procedure, it's hard to see kind of like where to put your filler. So you want to say that the topographic area is still maintained, so you know where you're doing. And if you're swollen, I'm not sure I'm seeing the naturalness of what I'm trying to enhance or fill. So that would be something I would consider as well. Good question. Thank you.
Yeah, and one of the benefits of doing something like that same day is that if there's going to be downtime, you can get it all done at once. And again, these are two procedures. Fillers and peels are really targeting very different layers of the skin. So in general, this is something that can be done on the same day, but you really have to see how the skin reacts, and every case is a little bit different.
Sounds good. All right, this is from Denny. Denny asked, what is the best winter skincare tip? So I see some people joining, and I know that they're from different areas of the country. Dr. Jonathan Sykes, we are honored that you're here today. Thank you so much. So you guys may not be experiencing what we're experiencing, but we're going deep into winter here in Chicago. And what are some tips?
So really, cold weather climates, you really do have to change your skincare routine. Everyone I see, whether you have any type of skin condition, acne, rosacea, whatever, your skin will get more dry and not hold on to moisture as well in the cold, dry weather. It's about 15 degrees outside here today. So I think switching your moisturizing. So you think about using like a thicker cream, something heavier versus a thinner lotion. Something a little bit more occlusive is going to help the skin retain moisture better. I get a lot of questions about hyaluronic acid serums, which I like to say hyaluronic acid helps your skin retain moisture, but it's not really a moisturizer in and of itself. So it's something kind of like an addition, a booster to any regimen, and usually they're in like a serum form. So I like to apply thinnest to thickest, so that'll be the first layer. And then whatever other product you're using, but always wanting to seal it with a thicker moisturizing cream and something non-comedogenic, oil-free, so it's not going to be stimulating acne. You also have to be careful with the over-exfoliating in the winter. People love to exfoliate, and in many cases, they're just doing too much.
Right, if you're seeing that dry skin, you think that you need to get it off, so you exfoliate, and you're just compounding the problem.
That's actually going to make it worse. So I see people all the time that come in very irritated, very dry, and they're not sure what's going on, and we really have to kind of simplify and make little tweaks. So, okay, next question.
Thank you so much. If anyone has questions out there, please let us know.
Dr. Pritzker. This is from Elizabeth Janice. Is microneedling the best option for acne scarring?
Oh my goodness. Actually, we're treating some major acne scars in the other room right now. We're in between procedures. And acne scars is a whole ball of wax.
We could spend the whole 15 minutes talking about acne scarring.
There's so many different types of acne scars. There's different depths of acne scars, and the patient's skin type and condition can really dictate what procedure you want to do. So whenever I have a consult for acne scars, I always say we're going to have to do a combination of different devices, skincare, and a whole bunch of tweaking in the middle of this. And I always come up with the plan of we're going to do 3 or 4 of this first, then we're going to switch, and then I can't give you all of the treatments until I see what's kind of changing. So microneedling is great for skincare. The things that are great about microneedling is that downtime tends not to be too long.
It's great for all skin types because you're not delivering a heat-based energy into the skin. The microneedling is creating these little tiny channels mechanically, and that will allow the body to then jumpstart the collagen stimulation process. So that's very safe for darker skin types, so you don't worry as much about hyperpigmentation after the procedure.
Right. It's good for some of the color that's left behind from some of the acne that you've had, but it's always in combination with other things.
Yeah, and I think in general, microneedling is great for just overall texture rejuvenation, pore size. I think for those really deeper scars, we have to think about a little bit more aggressive laser energy. But really, all scars are different, and we really have to take a lot of things into consideration, like skin type and type of scars. So, next question.
All right, I got the same winter skincare tip.
Okay, so we don't want to do a repeat.
Holly K, 24. Do you think that there is a benefit of AntiMicrobial pillowcases to help reduce acne, particularly silver thread pillowcase?
Interesting question. So, bacteria that live on the skin is one of the many causes, one of the things that can contribute to acne. It's not, in my opinion, the main driving force of most types of acne. I think in general, there are antimicrobial skincare products such as benzoyl peroxide, sometimes prescription products. We use a lot of clindamycin. Using a specific type of pillowcase like this is not something I generally recommend. I don't think it would be harmful. I think that I'm not sure it would have any real benefit, so if it's really expensive, I would probably say don't waste your money on that, and you maybe try something that we know we have seen proven results from. But hey, if it's good stocking stuffer, good present for someone, if it feels soft and smooth, then maybe you like it.
Okay, I gave you socks, so maybe
yes.
next time.
Yeah. Anything else about that?
No, I absolutely agree with that. I don't know much about it, but I always think about the bacteria that's already endogenous in your skin as opposed to exterior, so I'm not sure quite yet about that.
I do, sometimes that comes up with just sensitive, actually for hair loss, with people thinking that their pillowcases or sheets are irritating for their scalp, and using like a softer silk-based pillowcase to help, just for more gentle on the skin and scalp, but it's not something I routinely recommend. Okay, whose turn?
You are asking me.
Okay. From Monica. What is the best time to do injectables before a big event?
Oh, my favorite question. Here's why. Not the day before.
Yes.
So I get a lot of people, and it is not, I'm joking about it, but they don't know, right? They don't really understand that there could be bruising and swelling, even with something like a Botox or a Dysport, Xeomin or Jeuveau, which is the neuromodulators that we do. You know, as good as we are at injecting, there are blood vessels all over the face. You can talk to an anatomist like Dr. Jonathan Sykes, and he'll show you how many there really are. So there's always a potential for bruise. I'm introducing a needle to the face. So even if I'm just doing your Botox, I really would not like to touch your face right before the event. But it takes time for Botox, Dysport, all these neuromodulators, and filler to really take place, hydrate in the skin, take its final form, give you the result. So when we talk about, for example, like a bride, I really love to do their toxin, their neuromodulator, like 4 weeks before the event, because I really do think that A, it gives me time to tweak it, and B, it gives them this kind of nice, natural, like this feeling that they know. They don't want to feel like too frozen on a picture. They don't want to look unnatural. So it really has time to work in prior to that. If you have something else that's not like your major day of your entire life, you can do a little bit closer to the event, and it will hold and look beautiful as well. You could do filler 2 weeks before.
Yeah, and I think it's never a good idea to try a brand new procedure before a big event, like a wedding or a party. I think we can never predict with 100% certainty if you're going to bruise, if you're going to swell. Even from things like Botox that we don't normally have any downtime or see bruising or swelling, it can happen. Everyone reacts differently to fillers. Some people never bruise. Some people know that they're bruisers. So I would always recommend for something like a filler to leave at least a week if you really had a big important event coming up. You don't want to be stressing out about your healing
something different,
when something big in your life is about to happen.
We have crazy Gemini 12 in, and she actually made a really good point, or he, I'm so sorry. There are also good bacteria on your skin, and you may not want to kill that. So there's actually a lot of research going on right now about the natural microbiome that's on your skin, and how we're overdoing it and stripping it away, and then the skin is super reactive trying to get it back. So less is more for a lot of things when it comes to skincare, and it is a very good point, Crazy Gemini 12, that we want to keep that natural bacteria and stuff on your skin as well.
Yeah.
And also back to winter skincare tips, because I know we're gonna wrap up here. But if you have dry skin and it's like really patchy or really cracky or something, you may have something clinically going on that is more of the rash type than not just regular dry skin. So it is, wise to come see one of us at some point if your dry skin is just really not under control and a little bit worse than what you're anticipating being just kind of average winter skin, because we're treating every day. I see 5 or 6 patients a day with other medical conditions that are just kind of exacerbated by the winter, and I'm able to treat them with some prescriptions as well.
I couldn't agree more.
And with that being said, we really appreciate you guys tuning in to our first time.
Thank you for tuning in. You can catch Dr. Ibrahim on Wednesday, January 8th. And follow us at chicagodermatology.com for more details. Happy holidays.
Thank you.